My name is Captain Caitlin Devereaux, and my Tech Talk is on medical procedure simulators. We will frame our Tech Talk around combat casualty care and readiness in austere environments and how procedure trainers work in practice. Today's agenda includes what simulators are and how they work, state-of-the-art systems, use in today's military medicine, importance in austere environments, modeling and simulation, and what the future looks like. This picture on the right shows a medical procedure simulator using virtual reality for a knee procedure. What are medical procedure simulators? There's a spectrum for them, ranging from simple procedural trainers to fully immersive trauma simulation systems. Our task trainers replicate specific anatomy, like an arm used for IV access or an airway used for a Craig. The high-fidelity mannequins are full-body systems simulating an entire patient physiology, not just one specific portion of the body. The hybrid and virtual reality systems combine physical mannequins with virtual overlays to allow for real-life visualization. Overall, medical procedure simulators create a space where learners can perform skills, receive feedback, and increase technical expertise. Medical procedure simulators work in multiple ways in practice. They replicate anatomy and physiology, like modeling things like heart rate, blood pressure, and oxygenation. For example, if the patient is experiencing blood loss, the simulator will have decreased blood pressure and increased heart rate. These simulators can simulate pulses, blood flow, breathing, voice, and airway sounds. They also can recognize inputs and outputs. They can detect if the learner inserts a needle for a needle chest decompression or starts chest compressions for CPR. The outputs are based on the learner's performance, as the simulator can have increased or decreased bleeding based on what the learner is doing on the simulator. Their job is to respond to procedures and exhibit signs and symptoms that require intervention. Modern systems are very advanced and are used at a variety of hospitals, schools, and training centers. Algorithms can allow the simulators to show shock progression, respiratory failure, and the impacts of medications given. Mannequins can respond to medications given with realistic changes, both negative and positive. Simulation operators can change vitals mid-session, impart complications, and increase or decrease patient difficulty. The medical procedure simulators also have monitors that show heart rhythms, oxygen levels, and vitals, where learners have to interpret the data like a real patient. Many of the simulators utilized in the military show combat injuries like hemorrhage, airway obstruction, and pneumothorax. Recent research has shown that TBIs will need to be considered more than ever in our next fight due to advanced technology. This is something that will need to be added to medical procedure simulators when training our military healthcare personnel. Task trainers are most utilized for individual skills like IV access, needle chest decompressions, Craigs, and pneumothorax. Team-based training is essential and is focused on simulating a real-life scenario to work through. This includes the entire medical team, where there are multiple steps and interventions needed to save the patient's life. There can also be an element of increased pressure by ensuring the steps are conducted within a timely manner and to the standard of care. Medical procedure simulators are important because it improves outcomes in the real world. Learners are able to get hands-on experience through increased repetitions with feedback. Learners are able to make mistakes, adjust their techniques, and completely fail without the consequences. Failure is not feared because there is less at stake. We are also able to train to the same standard when using the simulators. Combat casualty care in an austere environment is very important as we relate using simulators to assist in training our military healthcare professionals to care for the warfighter in an austere environment. Simulators can replicate constrained resources like limited equipment and resupply and improvised care. Using virtual reality, we can add environmental stressors like increased noise, patient load, low visibility, constrained spaces, and overall increased amount of chaos to train on staying calm under pressure. These simulators can also model the impact of lack of patient evacuation capability and the need to conduct prolonged field care. This could mean progressive shock, infection, deterioration over time, and behavioral health issues. It is necessary that simulators are built to handle all weather conditions, dirt, and extreme handling like dragging a patient out of a combat zone or utilizing a buddy carry to get the patient to cover. Mathematical models have the ability to simulate circulation, oxygen transport, and the impacts of a variety of different medications. It also allows for system modeling, like trauma progression and multi-system failure based on the learner's medical decisions. Related to the military, this can be seen as blast injuries, mass casualty events, and triaging, including delayed, immediate, minimal, and expectant. In addition, it simulates decision-making under stress, communication, and team interactions. The future of medical procedure simulation is bright. With the increase in the use of artificial intelligence, simulators will have the ability to adapt immediately to the learner's medical decisions. They will be able to use real patient data and directly simulate it in a model. The use of augmented reality will be able to overlay internal anatomy during procedures for a real-life scenario, pictured on the right. Related to the military, this is extra important for our forward resuscitative surgical detachment teams to ensure they are training on a variety of scenarios in the operating room. There are also simulators that are lightweight and portable, as well as creating a variety of different scenarios based on threats and trends. This is specifically helpful for the military to be able to train on specific injury patterns like hemorrhage and TBIs. The future of medical procedure simulators has a large impact for the military healthcare community. Utilizing these can allow medics, doctors, nurses, etc. to certify their skills more frequently and quicker, allowing us to generate a ready force at all times. We can create personalized training pathways based on what is occurring downrange to better be able to serve and care for our warfighters. Overall, medical procedure simulators are systems that allow medical personnel to get realistic procedural training under a variety of different environments and constraints. The use of this technology directly improves medical decision-making, critical thinking skills, speed, and survival outcomes for our patients.